The Human Sciences Research Council, the HSRC, along with the University of Southampton in the United Kingdom, have collaborated to form a report based on couples-focused intervention aimed at promoting couples HIV testing and counselling. The Igugu Lethu report involved couples being offered screening and support for other health conditions, including diabetes and other HIV and AIDS-related sicknesses. The results of the study showed that the changes made to the couples intervention were successful in supporting more couples to decide to test for HIV together. Professor Nuala McGrath, who is the principal investigator of the Igugu Lethu study of the Human Sciences Research Council, joins us now via Zoom. Very warm welcome to you, Prof. We appreciate you joining us here on SABC News.
Thank you for having me.
All right, Prof, let's talk about, what this research entailed and why the sort of specific focus on couples when it comes to testing for HIV.
Sure. So we're trying to fill the gap we see currently in that in some couples, either one or both of the partners do not know their HIV status, or if they know their HIV status, there are many couples who have not disclosed their HIV status to each other.
Yeah.
So the goal of the Igugu Lethu study was to test whether a couples-focused intervention could help these type of couples to decide to test together for HIV, because there's evidence that when couples test together and learn each other's HIV status, then they have the opportunity to better respond to the results and plan their future together.
I mean, Prof, what did you find in your findings? Did you find that more couples were indeed HIV positive, together, both of them were indeed HIV positive? Or did you find a lot of that, which you're talking about, where one isn't, in fact, one is HIV negative and the other is HIV positive? Was that something that you found quite a bit of?
So of all the couples that we worked with, 56% of the couples chose, having been part of our intervention, they chose to test together for the first time. Mm-hmm. Among those couples who tested for HIV together, we found 64% of the couples had at least one partner who had HIV. So there were a minority of couples who did not have any HIV in their relationship, but the majority of couples had HIV with at least one partner, some of those with both partners having HIV. And this just gave them a chance to face that reality together and to start to plan to take access to HIV care, but also how they will plan the rest of their lives together.
I mean, was there concern that, the study might indeed backfire in the sense that, you find a situation where, couples sort of perhaps blame each other? I mean, I'm also now talking about a psychological aspect of this all. Let's not forget that there continues to be a stigma attached to HIV and AIDS. And I wonder if that was something that, you were sensitive to.
So our intervention aimed to bring knowledge about HIV and other health conditions to the couple, and that was introduced to couples in the context of groups of couples together. And then we tried to give skills, particularly around communication, so that couples could be prepared if they potentially needed to have difficult conversations between them. And then in that, after the group sessions, we had an opportunity to support them with individual couples, one couple at a time, having counselling sessions with a counsellor where they discussed the barriers for them for HIV testing, but also discussed all the possible outcomes before they tested, so that they were prepared for whatever outcome came from their test results. They had an idea of how they were going to plan to move forward.
And what goes into this sort of counselling? I would assume there's pre and post counselling that would be involved. I mean, what goes into that?
So that counselling happens, in terms of the pre-test counselling, happens just before the testing, but the intervention itself is an opportunity of health education, but also providing communication skills and then facilitating those discussions. And part of the group setting, we divided the couples into men and women single gender groups, and they had a chance to discuss the barriers to testing and the concerns and worries that they had with other men and women separately before they came back to their partner and discussed in the counselling session those barriers for HIV testing. Yeah. So there's an opportunity for us to create that environment where they get to hear other people's opinions about the challenges, to think through their own barriers and thoughts before they start discussing it with their partner, and then the counsellor facilitates that discussion between the partners. And we were offering other tests, as you've already mentioned. Mm-hmm. So if couples if they decided to test together for HIV, we offered at that HIV testing visit additional tests of blood pressure measurement, weight and height measurement, blood glucose measurement as a screener for diabetes, and we offered STI testing. And we really saw that couples who decide to test together for HIV had an appetite then for all of those other tests, because they really see it as an opportunity for learning about their health status as a couple. And there's a motivation that's particularly and it's particularly motivating that even if I might have not been ready to test individually, there are couples who reach a point where they can see that it's useful as a couple to test and to find out about these health conditions and then support each other with once the results are known. So that's what we're excited about, because we broadened it to couples' health. HIV is one aspect of the couple's health, and it's an opportunity when you have this new knowledge about your status to then make the decisions about your health and your shared health as a couple going forward.
Of course, the AIDS conference is underway, and I just want to bring you in on something that is quite important that is being discussed, the issue of research that's involved around HIV vaccines. We're hearing that, this will be, a tough task, but of course, one would assume that, our health professionals and our professors like you are well equipped to come up with those kinds of solutions. What are your thoughts on this HIV vaccine and the possibility really of it?
Yeah, Professor Glenda Gray gave a great plenary this morning laying out the challenges for the HIV vaccine, the learning that we already have from the years of HIV vaccine work, which fed into the great progress we saw in COVID vaccines, and that equally now we have an opportunity to learn from the COVID vaccine work into the HIV work again. So HIV vaccine work is challenging. There are large groups of people involved in it. I personally am not involved in it, but it's definitely another branch of HIV prevention that we need to continue, and needs resources and commitment to continue for that.
Professor Nuala McGrath, we appreciate your time very much here on SABC News and all the work that you're doing. Thank you.